Florida health leaders are casting doubt on what the CDC calls our best defense against COVID-19.
Surgeon General Dr. Joseph Ladapo announced Florida will be the first state to recommend against vaccines for healthy children.
Yeah, we asked Governor DeSantis to clarify what that means for Floridians.
It's not saying to tell them to do this in like a broad way, saying this is never good for anybody. No, not at all. But when you have very low risk people, there's not been clinical support that this is really moving the needle.
I want to remind you, these are recommendations. The CDC says COVID-19 ranks as one of the top 10 causes of death for children ages 5 to 11. It says the benefits of the vaccine for children outweigh the risks. CDC says no serious safety concerns were identified when thousands of children participated in clinical trials for that vaccine. White House Press Secretary Jen Psaki endorsed the vaccines on Monday.
Let me just note that we know the science, we know the data, and what works, and what the most effective steps are in protecting people of a range of ages from hospitalization and even death.
Children in Florida have the lowest vaccination rates compared to other states, so let's take a deeper dive here. According to the most recent weekly report from the state, only 22% of children who are ages 5 to 11 have received a vaccine. The rate nearly triples to 60% in ages 12 to 19, but that's still the second lowest rate. The age groups with the highest vaccination rates are people who are 60 and older.
Students in Hillsborough County returning to school after a long weekend with new COVID guidelines, too. Students and staff who get COVID will be allowed to return to school 6 days after showing symptoms, or if they don't have symptoms, 6 days after testing positive. That is, as long as they don't have a fever the day before. This matches the state's guidelines, too.